I just want to give a couple of examples of some specific applications to craniosacral therapy. It can help people in any age group, any bracket, but a couple of things we found that craniosacral is very good as an application is in pediatrics. This is Oscar again. If you look at an infant skull, sometimes during birth, as people zoom down the birth canal, or not, there can be a little constriction. In fact, this is birth. It's like the head can be squozen, which is not a medical term. But basically with craniosacral, you can very gently support the skull and actually remold it and allow this very soft osseous structure, which is more like membrane, to become more spherical. If you've ever seen a child that looks like they have like a little, what do we call it? Like a little, paired head or something, a little peaked head, it can help normalize that. This is very useful for the treatment of cerebral palsy, where there can be a restriction in this coronal suture. This can help relieve spasticity in a child. Also with autism, which is unfortunately on the rise, and what happens is that in this membrane system, there's a membrane system that's horizontal inside the head, and a lot of the cranial nerves nest between this membrane system horizontally. And if with a child with autism, this membrane system can get very, very tight, like a gasket that's too tight, puts a lot of pressure on the cranial nerves, and it's very painful for a child. So with craniosacral therapy, very, very gently and very non-invasively, molding with the skull, you can literally release pressure on the skull. And we've had some pretty good results working on kids with autism. And also actually takes heavy metals across the blood-brain barrier and releases toxicity. So not all the time, but probably 50% of the time we've had some pretty good results with that. So it's got a great application for children of all ages and applications. And as well, an application I just kind of stumbled into was working on people with dementia and Alzheimer's. There's about 6 million people in the United States right now with Alzheimer's and about 22 million caregivers, not all of whom deal with people with Alzheimer's, but a significant percentage. And what we found by doing a simple still point that we can teach in a one-day seminar, it takes about 5 minutes to do, it's like a mini craniosacral treatment, we can actually, in the same principles we're working with autistic kids that might have toxicity, with older people, we can basically connect with the cerebrospinal fluid in the skull and allow heavy metals to be passed through the blood-brain barrier out into the body and relieve the toxicity. And we've actually done a national study founded by the National Institute of Health and published in the American Journal of Gerontological Nursing. And we found we've had some significant results, even doing a 5-minute still point in a nursing home where we had a 100-year-old lady who was able to begin to feed herself and speak in complete sentences. So we want to create a national program to help people and even teach caregivers. We want to start doing even a pilot study here in Fairfield. So those are a couple of just applications out of very many where craniosacral has seemed to be having a good effect. So thanks for listening.